What things have you learned to make that process, palatable, doable? Any tips you have for people who want to get into that but are afraid of that aspect of it?
Yeah, most of us don't come from the background of sort of dealing with this kind of stuff, and that's not oral surgeon. I'm just talking about in general. Most healthcare providers don't spend a lot of time learning how to do conflict resolution and walk people through behavioral issues. And so when you do this, so at Swedish they do something called the PLA, the Physician Leadership Academy. And so what'll happen there is there are providers that are sort of targeted, the C-suite or other providers say, "Man, this person would make, I think, a good hospital leader or whatever." And that's kind of where I got sucked into stuff. When I was the section chief of OMS, I got pegged to go to this Physician Leadership Academy thing, and effectively they in these little things, which that was like one evening a month for whatever 2 hours. But you basically go in there and they teach you how to do this stuff. So you're kind of in there and you're learning about hospital administration, and you do like little role playing things to do conflict resolution. And then as part of like the medical executive committee, there are so many options and opportunities for you to kind of go out and do educational programs on the dime of whoever it is that's teaching you. So like Swedish, like they have chief of staff meetings. Like there's one that kind of conflicted with this meeting at Amos, that where it was in North Carolina, and they send you out there and you just sort of learn how to be a leader. They do leadership training programs where they teach you how to do conflict resolution, teach you how to talk to people. You meet with the legal side of stuff and talk about what you can do and where the legal bounds are, et cetera. So I would say I wouldn't let that dissuade you from doing something like this, because they'll teach you how to do it. You kind of get in there and you sort of slowly learn how to do the stuff that you don't have to go like freestyle it. They're going to teach you in a methodical way how to go about doing stuff like this.
That's good to know that there's those resources, and hopefully most medical centers would support and potentially pay for you to go to those trainings and
Yeah.
things like that.